Survivors of colon cancer whose diet is high in complex sugars and carbohydrate-rich foods are much more likely to have a recurrence of the disease compared to patients who eat a more balanced range of foods, according to a study by the Dana-Farber Cancer Institute. The authors wrote that the link is especially strong amongst patients who are overweight or obese. Over 1,000 patients with advanced colon cancer participated in the study, one of the first to analyze how diet can impact disease progression. Recent research has found that colon cancer survivors whose diet and activity patterns resulted in excess amounts of insulin in the blood have an elevated risk of cancer recurrence and death from the disease. Elevated insulin levels can be produced by consuming large amounts of starchy and sugary foods. The study involved 1,000 stage 3 colon cancer patients who participated in a cancer and leukemia clinical trial of follow-up chemotherapy for their disease. Participants reported their dietary intake during and 6 months following the trial. The researchers discovered that participants with the highest levels of sugary and carbohydrate intake had an 80% increased risk of colon cancer recurrence or death when compared with participants who had only the lowest levels. Among patients who were overweight or obese, the increase in cancer risk was even higher. Lead author Jeffrey Meyerhart concludes, "In light of our and others' research, we theorize that factors including a high glycemic load may stimulate the body's production of insulin. That in turn may increase the proliferation of cells.